Hello and welcome to Excellence in Practice Voices for Better Care, a podcast by the National Centre of Excellence in Intellectual Disability Health. Here we will be sharing real stories and advice from expert clinicians and people with lived experience on improving healthcare for people with intellectual disability. We hope you enjoy this episode. I'm Ricky Kremer and I am co-hosting with Raylene Griffiths.
The National Centre of Excellence in Intellectual Disability Health recognises and respects the traditional custodians of country across Australia. We acknowledge their deep and ongoing connection to land, waters, and community, and pay our respect to elders past and present.
This podcast includes discussions about the healthcare experiences of people with intellectual disability. This episode contains stories about mental health care, including mentions of trauma, medical mistreatment, or discrimination, and could be distressing for some listeners. If you are uncomfortable, please take a break or skip this episode. Thank you for joining us for this episode on mental health care for people with intellectual disability. People with intellectual disability experience the same mental health needs as anyone else. Unfortunately, they often face more barriers when it comes to identifying there is a problem, getting support and treatment. In this episode, we will be speaking to Rebecca Koncz, who is the UNSW Chair of Intellectual Disability Mental Health. Within the centre, she is also an experienced clinician and researcher with a focus on mental health. We will also be speaking to Rory Keyes, who is a self-advocate, researcher, and project worker at the centre, who will talk about their lived experience. Thank you, Rebecca and Rory, for joining us to talk about such an important topic. To our listeners, we hope you enjoy the episode and learn how you can deliver better healthcare for people with intellectual disability. Welcome to the podcast, and thank you for joining us today.
Sure.
Can you please start by telling us about yourself and your experience working with people with intellectual disability in healthcare?
Sure. Thanks so much for having me along today, Ricky. So, I work at the National Centre of Excellence in Intellectual Disability Health, and my role is as Chair of Intellectual Disability Mental Health. It's supported by the New South Wales Government and the Australian Government. So, in this role, I work with people with intellectual disability, their families and supporters, as well as health and disability services, the government, and other key organisations to improve mental health outcomes for people with intellectual disability. And I try to do this by doing research and training together with people with intellectual disability to help health and disability workers understand how to support people with intellectual disability and mental health needs. So that's part of what I do, but I'm also a psychiatrist. So I'm a doctor who helps people with their mental health. And for the past 10 years, I've worked with adults with intellectual disability and their families and supporters in mental health services. And in that role, I help to understand and support patients with their health and mental health and work with them to help reach their goals, which is a very rewarding part of my job.
That's great. Thank you for that. You have clearly had a lot of experience in this area. What are some of the biggest challenges when it comes to mental health care for people with intellectual disability? And how have you seen these challenges come up in your practice or with colleagues?
It's a really good question. And unfortunately, there are a lot of challenges when it comes to getting good mental health care for people with intellectual disability. So, firstly, we know that people with intellectual disability are more likely to have mental health concerns. So, about 76 out of every 100 people with intellectual disability experience mental health issues, compared to 38 out of 100 people in the general community. But even though this need is high, getting the right help can be really difficult. And there are lots of different reasons for this. But some examples that I see in my practice are um, one, many mental health workers don't actually feel confident working with people with intellectual disability. And this is in part and shown by research that tells us that clinicians often don't get much training or experience um, in their education courses, so they might not understand how to give the right support. The second big problem that I see is something called diagnostic overshadowing. And this happens when a doctor or a clinician sees a person's disability but might not notice or understand their mental health problems. So, for example, if someone's actually really depressed or anxious, it might be missed because people assume it's just part of the disability. So, that's another really big challenge that I see people face. And then another really big one that I'll comment on is that we simply need more services. And there have been great improvements over the last 10 years with more mental health services um, that are specialist services for people with intellectual disability. And that is a really positive step. But we definitely still need more support, more places all across Australia so everyone can get the care that they need. So, unfortunately, a lot of the health systems that we work in are very complex. So there are differences between services that are funded by the state government. There's difference, and then others that are funded by the Australian government, such as primary health care networks or general practitioners. And a lot of these times, the systems don't actually have a very coordinated or integrated setup. So it means that it can be really difficult for people to navigate. I think it's often difficult even for staff to navigate. Those of us working in the system, sometimes it can be hard to know where to turn to or who to ask for help. And so, actually, I do see that for people with intellectual disabilities and their families, one of the biggest challenges is knowing actually where to turn to for help when it's needed. So that is part of the work that needs to be done, really, is to help make those systems more streamlined and more integrated and more accessible and visible for people who need to access them. Access remains a challenge and it is highly variable depending on where you lived in Australia. So in Australia, we are fortunate to have a good public mental health system, but I do acknowledge that access varies from place to place. I think in increasing access, we need to be thinking about the different types of mental health supports that are available. But a lot of mental health care actually takes place in a primary care setting. So that's accessing general practitioners and practice nurses in primary care. So I think part of the challenge there, I have a lot of respect for people working in primary health care, but part of the challenge is ensuring that there are systems in place to support working with people with intellectual disability. And what I mean by that is adequate funding through Medicare to make sure that GPs can take the time and resource that's required to do good mental health care for people with complex and varied needs. So that's one thing. I think increasingly we should be thinking about how technology is incorporated into good mental health care and improving access to mental health care as well. And that would be another way of potentially breaking down some of the barriers to access. And I think increasingly in recent years, that has been a way that people have been able to perhaps tap into mental health support, whether that's through primary care, through psychology, through other specialist services, um, in ways that perhaps 10 years ago we just wouldn't have been able to do that. So that's definitely one of the big challenges ahead of us.
Yeah, absolutely. Thank you. So, another question I'd like to ask you is, can you tell us about a time when you were able to work with a patient to overcome some of these challenges and provide mental health care that worked well for them? And what made this experience positive for them?
Is a great question.
Yeah.
And to be honest, I think maybe the best people to ask about a time that worked well are really my patients and families. But something that people have told me they really appreciate and works well is when a doctor just takes the time to listen, to understand what's going on for them, what they're worried about, and what kind of support they want. And another thing is that it's also really important to include the person in every part of their care and to make changes that suit their preferences or needs. This might mean using different ways of communicating or giving someone time to get ready for appointments and information to get ready for appointments, or having um, sessions broken up into shorter sessions so that it doesn't feel so stressful to someone. An example maybe that I can share is about a man who I saw not long ago. He has mild intellectual disability, cerebral palsy and bipolar disorder, which is a mood disorder. And he came into hospital quite depressed after his dad passed away from cancer. And I was asked by his treating team, the inpatient mental health team, to help with his mental health care. So myself and the people I work with spent time listening and understanding the problems. We talked through what kind of support he needed and gave suggestions about treatment, including medication, and worked with the hospital team to speak up for him to get more NDIS supports. The mental health team is doing a great job, and together we were able to support the person. And now he's at the point of getting ready to transition out of hospital back home with more support in place. And that's just one example. But I think what this experience shows is that listening and working together can make a big difference to someone's care.
That's great. I love that idea of the patient that you treat should be the one that gives the reflection of how it's going. So,
Absolutely.
yeah.
That's so important.
So, reflecting on your experiences, how has your approach to care evolved over time to provide more inclusive care for people with intellectual disability?
I think to provide more inclusive care over time, I've learned that I have to be more flexible and open in how I work with people because everyone's different. So it's really important to try to understand each person's different needs and abilities and preferences. So an example of this is when I'm sitting in a clinic. Some people are very happy just to sit in the chair for their appointment, but others might feel more comfortable lying on the clinic bed or actually even prefer to have their appointment with me over telehealth. And so I just try to adapt to what works best for each person. The other thing that I've really had to learn is that it sounds maybe simple, but in practice, people are part of a bigger system, like their family or a group home or a support team or a workplace. And although it's really important to keep the person at the center of everything that we do, we also need to think about the different things in their life that could be affecting their mental health. So that's another thing that I think I've had to learn over the last 10 years. And then the final thing I might say is that one of the biggest lessons I've learned is really quite simple, and that's just to talk less and listen more, because that's how we really truly understand what someone needs and how to support them best.
You're also an experienced researcher. What have you learned are some changes healthcare workers can make to improve the experience for people with intellectual disability in mental health care through your research?
Through, I think, clinical experience and research, I think um, we find that small changes can make big differences. So, one small thing that can make a big difference for healthcare workers is around their attitude and our attitude towards working with people with intellectual disability. I think it's very commonly found, not just in research, but in clinical practice, that people still feel like that's not my area, or perhaps that's someone else's job. But the reality is, mental health care for people with intellectual disability is something that we as health practitioners all need to take responsibility for. And often, when I'm working with other clinicians, the message that I give them is that everyone has a role to play. People with intellectual disability have the same right to mental health care as anyone else. And from the research that I'd mentioned earlier, we know that they're more likely to have mental health conditions. So when a person with intellectual disability comes in with changes to how they're feeling or behaving, I think it's really important for health professionals to not dismiss things, but rather take the possibility of mental health concerns seriously and consider it as a real possible reason for their presentation. Another important thing or area for change is that actually many health professionals really do have the right skills, but the challenge is that they don't feel confident to use them. So it may not be about needing new training, but it's about building confidence working with people with intellectual disability. And part of that is just recognizing that it's okay to ask for help. So, an example of that is that I work with a very experienced neurologist, and he's an expert in young onset dementia. But he says he's not an expert in working with people with possible young onset dementia with intellectual disability. So, in that case, we've actually worked together on some assessments and done them jointly. And it's a win-win because we learn from one another, and actually that teamwork helps to get the person the best care possible.
Yeah, absolutely. The next question I have for you is, what have people with intellectual disability taught you about mental health support and how it should be delivered?
Really, I think people with intellectual disability and their families who I've worked with have taught me so much. And they truly have been some of my greatest teachers over the years. They've taught me what it really means to be inclusive. They've helped me to understand how important it is to listen, to include people in their own care, and to design and deliver health and mental health services that actually work for people with intellectual disability. They've also shared some of their most difficult moments and shared with me how hard it can be to get help. And many people have told me that it's difficult to access support through regular mental health services. and that it's even harder to find specialist care that understands how to work with people with intellectual disability. So I guess these are some of the messages that, in hearing these stories, reminds me why we are all doing the work that we're doing and why it's so important what we're doing here at the centre.
Yeah, absolutely. Doing a lot of great work at the center. The next question is there anything else you would say to healthcare professionals who want to make their practices more inclusive and accessible for people with intellectual disability?
I think there are a few things that I would say about that. And perhaps I'll start with saying that it's okay to start small, that it's important to stay curious, and also just don't be afraid to ask for help. Because as I mentioned earlier, even small changes like modifying our communication style, speaking clearly, checking in to make sure that someone understands, or giving extra time in a consultation can make a really big difference to someone's participation in the consultation. And in staying curious, it's about continued lifelong learning and learning from the people that we're sitting with in the clinics or in the hospital setting, asking the person what works best for them, and include families or supporters when it helps as well. And the other thing is really that if you're not sure what to do, that's okay, but just ask. So, talking to colleagues, reaching out to specialists, and there are lots of helpful resources online. So, there are things like the IDMH Connect website or our IDMH e-learning website. And for New South Wales health staff, some of that is actually available through the My Health Learning platform. And then there's also our website, so the National Centre of Excellence in Intellectual Disability Health, which continues to grow and will house more and more information and hopefully helpful resources for health practitioners. In New South Wales, we also have a strong network of intellectual disability mental health professionals across all local health districts. And so there is usually someone in your local area who knows who to contact in your local area. And perhaps other states and territories may have their own networks or supports as well. And finally, I think the most important thing to remember is, as health professionals, we all have a role to play in making mental health care more inclusive for people with intellectual disability.
Mm, thank you. That was very valuable. And thank you for the shout out on our website.
Pleasure. Thanks so much, Ricky. It's been a pleasure to talk with you. Thanks so much for having me along.
Thank you. Thank you, Rebecca, for sharing your experiences and stories as a clinician and researcher. We will now hear from Rory Keyes, who will share their experience with and advice on mental health care.
Hi, Rory. Thank you for joining us today. Can you please start by introducing yourself and your work?
Hi, thanks for having me. My name's Rory Keyes. I'm autistic, have cerebral palsy, and intellectual disability. I'm a researcher at the National Centre of Excellence in Intellectual Disability Health with the 3DN team, and I'm also a project worker with the Resource and Innovation team. I'm currently working to change the current heart health guidelines for medical professionals, and I'm also co-designing and co-developing the Accessible Knowledge Exchange Hub.
Thank you for joining us to talk about such an important topic. Can you tell us about what your experience has been like in the healthcare system, especially when seeking help for mental health?
Well, I live in the Blue Mountains in New South Wales, and we don't have a great healthcare system up here. We have wait times of up to 2 months or more just to see a GP. And when we do see a GP, they don't listen to what we need, order blood tests for no reason, and then rush you out the door. I can't afford to go to a doctor that doesn't bulk bill, so finding that right now is also super hard. For me to be able to go to a decent doctor, I have to travel up to an hour or more to go out west, and then they have wait times for up to 3 months as well. Doctors don't listen to what you need and don't account for you having a disability or any higher support needs. I find it hard to go to the doctors by myself because I can't communicate properly and I feel really intimidated. We don't have many mental health support options here, as most of them are full or require a referral. I got a referral to the mental health access team here and had one meeting with them, and they said they would get back to me in a couple of days and organize everything. But they never contacted me again. And when I tried to contact them again, they said they had no idea who I was and that they'd never seen me before. They were also really in your face and really full on and really hard to be around. And unfortunately, most psychologists and counselors are like that here. I feel like it was a very difficult thing to access because when you've got things on top of other things, like I've got autism and intellectual disability, but I've got cerebral palsy and ADHD and anxiety and depression and all these other things on top of it. It makes it really hard to access really any support for anything. Because most doctors or health professionals look at that and go, "Oh, that's too much to handle. We can't help you with that," or they just freak out and as these guys did in the mountains, don't get back to you again. They just don't know what to do. I'd say that access is a pretty important thing. We need to have things available, and they need to be easy to access. They need to be accessible. But it's also that they need to not like healthcare professionals need to not freak out when they see a whole heap of things because most of the time we're not there for all of those heap of things. We're there for one reason. Like if it's mental health, like if I'm depressed and need to talk to a psychologist, like I need medication or something, um, then I would go to them for that. I wouldn't be going there because I'm like, oh, but I'm having these issues at work with concentrating or whatever. That might be my ADHD. It's not. That's you go to one person for one thing. That's why there's so many different areas. There's psychiatrists, there's psychologists, there's counselors, there's GPs. There's so many different medical professions out there. That's why you'd go to different people for different things.
Thank you for sharing your experiences. It is important that we share these stories. Can you tell us about a time when you felt listened to, understood, and comfortable with a healthcare professional? What did they do that made the experience a good one?
So I went to a doctor in Bathurst, which is about an hour away from me. That's usually where we have to get doctors nowadays. She made me feel really welcome and heard. She listened to what I needed and helped me get it. She was really calm and level-headed and wasn't uptight, loud, or in a rush like most doctors are. And she was just really good in general.
Thank you for sharing that. What do you wish healthcare professionals, especially the ones working in mental health, would know when treating people with intellectual disability or higher support needs?
I wish healthcare professionals would understand that we have higher support needs and that they need to stay calm and be level-headed and not loud.
Thank you for sharing that. It is very important information for workers to know. Is there any other advice you would give to healthcare professionals who want to make their practices more inclusive and accessible to people with intellectual disability?
I think health professionals need to use the resources available to prescribe the correct medications to people with intellectual disabilities as well as neurodiverse individuals. They shouldn't have to suffer because doctors won't listen to us.
Rory, what's your advice for other people who also have intellectual disabilities in how to get the best care for themselves?
I think the best thing to do is to get support when you need it. Maybe get a support worker, a carer, a member of your family, maybe a friend, to come and kind of help you communicate if need be. You need to really advocate for yourself, and that is extremely difficult. So that's why you might need the support. Maybe get involved with things like self-advocacy groups and learn those skills as well. Just basically get help if you need it from other people, and just push through. It's hard, but you'll get there eventually.
Thank you for your time and for sharing your story. Your work with the Centre is making a big difference.
Thank you for listening to Excellence in Practice, Voices for Better Care. We hope you enjoyed the episode and learned more about delivering better care for people with intellectual disability. If you've been affected by anything discussed in this episode, please know you're not alone. Support is available. If you're in crisis or need someone to talk to, you can contact Lifeline at 131114 in Australia. To learn more about the work of the National Centre of Excellence in Intellectual Disability Health or to get involved, visit our website nceidh.org.au.